So there is a 30-year-old female para-2 live 2 had a forceps delivery 2 days back. There was injury to the head of the baby, resulting in the collection of blood in the soft tissue between the pericranium and the flat bone of skull, limited by the suture line. What is the probable diagnosis? So there are various hints in the question. The first one is there is a instrumental delivery, means there is a forceps delivery. Second, it is saying that it was 2 days back and the swelling is now present. So that swelling took time. Swelling was not instantly present at birth, but swelling took time to develop. So it was a delayed swelling. Number 3, it is clearly saying that the blood is between pericranium. So blood is between pericranium and flat bone of skulls Second, it is talking that it is limited by suture line. So the suture lines are not crossed. So the answer will be the cephalohematoma. So the correct answer will be the cephalohematoma. So what is cephalohematoma? So we must know that what are the layers of scalp. So scalp layers are SCALP. Scalp. S for skin, C for connective tissue, A for aponeurosis, and it is aponeurosis of which muscle? This is the galea aponeurotica. So we have the occipitofrontalis muscles whose aponeurosis it is galea aponeurotica. We have the loose areolar tissue, and then we have the pericranium, or we have the periosteum of the skull bone. So there is a cephalohematoma that we are talking. So we can see there is a skin, below that there is a connective tissue of yellow color, then we have the galea aponeurotica, and then we have the loose areolar tissue, and then we have the periosteum. It is present, and then there is a bone. So it is present between the bone and then the periosteum. So it is here, and we can very well see that it cannot cross the suture line, so it will be limited by suture line. So that is the cephalohematoma. If we come to other options, that why caput succedaneum is not correct, and that why the option cannot be the caput succedaneum. So what is the caput succedaneum? Caput succedaneum means that the swelling lies above the periosteum. So this is caput succedaneum. So here there is periosteum is here, that we have marked by the red line, but the swelling is here in the connective tissue. So it is the edema of the scalp above the periosteum. So the characteristic is that it is present at birth. So it will present at birth, and it is going to cross the suture line. We can very well see that it can cross the suture line. So it will not be limited by the suture line. So it will be crossing the suture line. So it will be present at birth and it will be crossing the suture line. So if we go by the scalp layers, so we have seen that the cephalohematoma was present below the periosteum, while this caput succedaneum is present in the connective tissue layer. So it is present here. Now coming to the other option, that is intraventricular hemorrhage. So intraventricular hemorrhage is inside the brain. It is in the ventricle layer. So whenever there will be ventricle in the brain, it will be present there. So it is not a scalp swelling. So first thing, it is not a scalp swelling. Number 2, it will be present in the premature babies. So it is not a scalp swelling. So this is again wrong. Coming to the subgaleal hemorrhage. Subgaleal hemorrhage means that you have seen there is a layer of the galea aponeurotica. So this layer, there is a galea aponeurotica. So whenever there will be hemorrhage below the galea aponeurotica, that we can see in this question, that there is a skin, then below this there is a connective tissue, and then below that there is a galea aponeurotica, the blue one, and the collection of the blood is between the galea aponeurotica and below it there is a periosteum. So there is a subgaleal hemorrhage. So galea aponeurotica, and below that the layer of loose areolar connective tissue, and then below that there is a periosteum. So below the galea aponeurotica, whenever there will be the collection of the blood, it will be the subgaleal hemorrhage. And the subgaleal hemorrhage, the characteristic, it is going to cross the sutures. So we can see in the diagram that it has crossed the sutures, it is going to cross the midline, it can spread over the entire scalp, and it causes massive blood loss and the shock in the child. So again the subgaleal hemorrhage is wrong. So the answer will be the cephalohematoma. Now in the exams there are sometimes they are asking the difference between the caput succedaneum and the cephalhematoma. So we must know that what is the difference between the caput succedaneum and cephalhematoma. Succedaneum and cephalhematoma. So there will be caput succedaneum and the cephalhematoma. So what are the various differences? So the first difference is in the location. So the caput succedaneum, the swelling will be present in the presenting part of the head. While in the case of cephalhematoma, it will be present in between the periosteum of skull bone and the skull bone. This is the first difference. Second, the difference is time of appearance. So in the caput succedaneum, the swelling will be present immediately after birth. In the case of cephalhematoma, it will take time. So it will take about several hours after birth. As we have seen in this question, it took about 2 days to develop or to appear. Now the third thing is cause. What is the cause of caput succedaneum? So the cause of caput succedaneum is prolonged labor. So the labor got prolonged. So there is a prolonged labor. It causes venous stasis, and it causes edema. So the caput succedaneum is because of the prolonged labor, which caused venous stasis, and there was edema. While the cephalhematoma is because of the instrumental delivery. As we have seen in this question, there was forceps delivery. So there was instrumental delivery, and this instrumental delivery caused injury, which leads to the rupture of emissary vein. It caused rupture of emissary veins in the skull. Now, other is extent of movement or extent of swelling. So we know that in the caput succedaneum, because it is above the periosteum thing, so it can cross both hemispheres. So it will go to both hemispheres. It can cross suture line. So whenever it is saying the suture lines are crossed, it is caput succedaneum. But when it is saying that it is limited to individual bone, and it does not cross suture line, it cannot cross suture line. So it does not cross suture lines. Now, period of absorption. So there is a blood or there is a swelling. How much time will it be taken for its absorption? So caput succedaneum develop instantly and also get absorbed instantly. So it's about 2 to 4 days. While for the cephalhematoma, it take about 2 weeks to 3 months to be reabsorbed completely. Now the treatment. So the treatment for the case of caput succedaneum is none. You have to just reassure the parents. While in the case of cephalhematoma, it is supportive, and it can also cause neonatal jaundice. So it can be one of the cause of the neonatal jaundice, the cephalhematoma. So this is